India's outbreak is spreading. Neighbouring Nepal is now recording 57 times more daily cases than last month. Both infection and death rates are at record highs. The coronavirus is overwhelming Nepal. Hospitals don't have enough beds. Staff have to treat patients outside.
The ground reality is horrible and depressing. Nepalese' worst fears are coming true as a nationwide surge of infections is pushing the health system to the brink of collapse.
The Red Cross warns of a human catastrophe in Nepal. Welcome to the show. I'm Ben Fazul, and millions of Nepalis work in India, but many are returning home due to the lockdowns and lack of work. A lot are also bringing an unwanted present for families and friends with them, COVID-19. Cases have exploded in border towns. In the capital, Kathmandu, 100 kilometres from the border, crematoriums have run out of space. Bodies are being burned on pyres in public places. We checked in with Bijay Acharya from the Johns-Hopkins University School of Medicine. I asked him who's to blame, all the Nepalis returning home from India or India itself?
Thank you for having me. I don't think that it's a blame game, to be honest, because the COVID was circulating in the Kathmandu Valley way beyond, like it never actually was under control, same way it was in India. I think it was easier to sort of blame it on the porous border and sort of differ from the responsibility of the government and the authority. That is what I think was frankly going on, because political rallies were going on, religious festivals were allowed, marriages, big marriages with hundreds of people were allowed since the numbers started declining last year. And even up to the last 3 weeks or so, people were still gathering for engagement parties, like weddings. Two big rallies were happening. The political parties were going out in full force. So I don't think it's fair to blame on some of the people just going back and forth from India and Nepal.
Are you talking about the situation in Nepal where rallies were going on and political rallies and gatherings and events?
Yes, and in Kathmandu Valley, where the numbers actually never went down. There were always people having COVID. They were going to the hospitals, but just not the scale of the rate of patients right now. But it never went down, and the political leaders, including our prime minister, never actually addressed the core issues. Just a couple of weeks ago, he was saying if you could mix guava leaf and gargle it, the COVID will go away on national TV.
Wow. So we can't turn back time, but what's the government doing now? Has it changed its tune? Has it taken a different tack? Is it clamping down?
They have initiated a lockdown and tried to stem the flow of people. But last year, they made a rash decision saying, all right, everyone will initiate lockdown. And what that led is all the people from villages and faraway places, they had to leave Kathmandu because they wouldn't have a place to earn, to make a living. And they all left. Around 500,000 people left Kathmandu in a day. And I wonder how many of them were asymptomatic carriers, right? So they're taking COVID from all across the country now. And within 2 weeks, we have seen more than nearly 100,000 cases going up. The death rate has climbed more than 250%. 2/3 of the country is high or higher risk of COVID right now. So it is actually I think that is a bigger super spreader event, in my opinion.
The situation sounds alarming. Is that how you describe it?
It is very dire. I've been talking to my friends and colleagues, physicians, doctors, other activists, and people are burnt out. They're frustrated. Just on the 8th of May, the Prime Minister had an interview with CNN where he blamed people for being negligent, which is kind of giving up a responsibility as a leader and saying this is how we're going to come out of this. And he basically said the situation is under control, and it is totally not under control.
So what are people doing to cope, and how are people coping, and how can they cope?
So a lot of young volunteers have risen up to this moment. It gives me a deja vu feeling of what happened after the large earthquake in 2015, where India was also under crisis, and we had to come up with solutions right away. There are different face groups which are active, connecting people. There's a group of people running a website called COVID Connect Nepal, where you can request housing, food, because you need a caretaker for your family member to be in the hospital, but then they don't have a place for the caretaker to stay because of COVID lockdown. So people are cooking meals at home. They are supplying meals to the local hospitals. We're all across the world, diaspora is raising money, trying to get oxygen concentrators. In the foundation that I work with, American Nepal Medical Foundation, we just raised $100,000 to staff a mass isolation center and a clinical care center along with the government of Nepal and Nepal Army. So, all of us are trying to pitch in, but we need to have a central authority who's directing all of these fragmented support services. And I think that is what is lacking, in my opinion.
Well, let's see if they can get their act together. I hope so. Bijay Acharya joining us from the Johns-Hopkins University School of Medicine. Thank you very much.
Thank you for your time, and thank you for having me.
And in news just in complicating the political situation in Nepal, or maybe even improving it, the Prime Minister has lost a vote of confidence in Parliament, failing to show he has enough support to stay in office. Well, the coronavirus, meantime, marches on, managing to invade every corner of the globe, even the world's highest mountain, Everest. As tourists gear up to make the world's most famous climb, there's a new danger that awaits them.
Last year, the pandemic devastated Nepal's tourism industry. So this year, authorities have eased quarantine rules and issued more than 400 climbing permits. A new record that may be allowing the virus to spread uncontained on Everest. To try to stop this, climbers are not allowed to socialize before they start their ascent. And customary religious ceremonies to pray for a safe expedition are now smaller, more private affairs. But the local Sherpas, guides, and cooks who depend on tourism and climbing for their livelihoods are worried. We're working here, and we're making sure we follow all protocols so that we can save ourselves from COVID-19. We try not to mingle. We used to have a lot of fun at base camp. We would sing and dance. But we don't have any of that now. We keep to ourselves and speak only within our teams. Health professionals at Everest Base Camp say they do not have the capacity to test for the disease. Dozens of people have been flown off base camp in recent weeks, and at least 2 tested positive afterwards. Yet the government has yet to confirm a single official COVID case on Everest.
Well, besides making it to the top of the world, there's something else climbers could do. Nepal has asked trekkers to bring back their empty oxygen tanks, which they usually abandon on the slopes. Let's see if they'll take on the extra load. Meantime, a team of mountaineering guides is setting up a separation line at the peak before climbers attempt to reach the summit from the Chinese side or come in contact with anyone or anything from the Nepalese side. In other news, Germany is making the Johnson & Johnson one-shot vaccine available to all adults. It had only been recommended for people over 60 because of blood clots in younger recipients. The government is now adopting the same approach as with the AstraZeneca shot in a move to get more people inoculated. Germany has managed to get the third wave under control in recent days and is trying to ramp up its vaccination rollout. Time to answer more of your questions now. Over to our science correspondent, Derek Williams.
What proposals are there to finance production and distribution of vaccines to countries not able to afford them?
The central proposal to do this is what's called the COVAX initiative. It was set up around a year ago by a coalition of different agencies, among them the World Health Organization, to help ensure access, even for the world's poorest countries, to the tools that they need to fight COVID-19, including vaccines that have been authorized by the WHO. COVAX is being funded by a number of wealthy countries, as well as private institutions like the Bill and Melinda Gates Foundation. Back in February, Ghana was the first country to receive vaccines sponsored by the initiative. A couple of months on, though, COVAX is still far from living up to its promise for a number of reasons. The primary one is that in a market where vaccines remain in short supply, money talks, and the countries that pledged to help provide access to poorer nations have snapped up almost all the vaccine being made straight off of production lines. So far, around half of the available doses have gone into arms in those wealthier countries. For instance, in Germany, over 30 million doses have been distributed until now. That's around 2.5% of all vaccinations given so far worldwide. In the Democratic Republic of Congo, on the other hand, which has a larger population, fewer than 5,000 doses have been given. So COVAX is still falling far short of the initiative's stated goals, even though practically every expert out there says that in a globalized world, leaving less wealthy nations out now could end up costing us some or even all of the progress that we've made so far.
Derek Williams there. I'm Ben Fazulin. Thanks for watching. Stay safe and see you again soon.